Hard, 5th grader at Mokina Intermediate School, interviewing Dr. Dave Rompala. Tell us about your background as a doctor, education, and experience. What are your specialties or expertise?
Oh, okay. I graduated my bachelor's degree from Western Illinois University in speech pathology and audiology. I did my master's work at Baylor University in Texas, and I did my doctoral work at Arizona University. I'm a licensed audiologist, and I have been practicing probably for the past 40 years. I worked at rehab hospitals, worked at personal physicians' offices too, but most of my career was at a community-based nonprofit speech and hearing clinic called Sertoma, and we would see children and adults who have speech hearing problems, and we've tested children as young as 3 hours old at the hospitals, and we've tested adults well above 90, and to determine if there's a hearing loss and what was the problem and what would be perhaps some solutions to their difficulties.
How did you happen to choose this career? How did you happen to choose this specialty?
Okay. My undergraduate degree, I started to be in psychology. And one of the requirements in psychology, you had to take a speech class, which means you had to stand up in front of people and give a talk. And the first requirement was a 15-second talk. Okay. So one of the people in the class was a stutterer. And about 2 minutes into the 15-second talk, he was still trying to get his 15-second talk done. A lot of people in class were actually starting to laugh at him because he was taking so long because of the hesitations that a stutterer has. And so I went to the professor after the class and I says, what do they do with someone who has a problem like that? And he says there's a little department. He didn't mean size, he meant number of people in the department, that sees people and helps people who have speech and hearing problems. So I started to take classes there, and I just enjoyed it.
What unique skills do you possess?
Okay, well that's difficult because what I think I might possess and what other people think I might even have might be two different things. I really enjoy seeing different people. In the field of audiology, you could see 25 people a day. And I like the testing from the point of view that after you test people, you can come up with some type of etiology or cause. And then you come up with some diagnosis and you come up with some idea of what you might do to help them. And you can do that 25 times a day. There are certain fields that you see like 2 people a day or 5 people a day. But I thoroughly enjoyed that, and I thoroughly enjoyed the age range from the young child to the geriatric or very old.
Describe the day-to-day activities, priorities, and tasks of a doctor of audiology.
We would start the day by testing the equipment to make sure that the equipment is giving out the signals that it should. And then the secretary would bring in one patient at a time in order to us to evaluate them. And we would see sometimes children, as I said, as young as hours old or day old in order to determine if they had a hearing loss. You're never too young for a hearing test. Across the other lines, you're never too old to get a hearing test. We also worked with handicapped individuals where, like if I was testing you and I asked this, if you hear the tone, raise your hand. Well, there's certain individuals, children and perhaps even some adults, who can't do that. So we have some special equipment where we're able to evaluate their hearing and their hearing loss by them just sitting there and relaxing. We're able to get some idea if there's a problem or not.
Describe your most successful accomplishments.
I think finishing this interview would be one of the top ones. Let's see. I think working at the speech and hearing clinic for 30 years and seeing it grow from one audiologist in one site to 3 sites and staff of about 30. However, of which I was only part of the success. I wasn't the only one working to help the community.
Do you have experience in treating babies and children with hearing loss?
I sure do. As I mentioned before, we've tested young children. They find out that children who aren't even born yet do respond to sound, and they've tested that. And there's a chance, and there has been some children that even have had some operations, even before they're born, in order to help their hearing. So when they are born, they'd have the likelihood of better hearing. The reason you need good hearing is because we live in a world that without good hearing, you don't develop good speech and language. And if you don't develop good speech and language, then you have a problem communicating. And so if you have a hearing loss, you're going to have a problem saying a sound correctly, or knowing that you're not saying it correctly. Learning a language. We learn language or vocabulary or sentence structure because of our hearing.
Can hearing loss from persistent ear fluid development delays cause development delays in a child?
Cause what in a child?
Development delays?
Oh, yeah, the developmental delays would be that in speech and language. Now, the certain specific problem you brought up with fluid in the ears. One of the most common surgeries for children is to drain the fluid in their ears. Fluid develops, especially in children, because the back of your throat, there is a tube that runs from your ear, and it's called the eustachian tube. And at your age, the tube is very flat. So when you do something like, or you have a cold or whatever, you actually take this material that's going in your throat and goes into your ear. And because there's no place for it to go, it starts to become infected. As you get a bigger head, which means as you get older, this tube actually tilts. And as it tilts, it makes it more difficult for fluid, infectious material to get into your ear. So that's one of the things where people say, oh, she outgrew a hearing loss. Well, she probably did, because she has a lot of problems with sinus or allergies when she was a child, and it caused its own problem in the middle ear, which is where the fluid would develop.
How long do ear tubes stay in?
Well, it depends. They do have tubes now that will stay in for longer periods of time. When they first started to put the PE tubes in, that's what they're called, they came out probably anywhere from 6 weeks to 6 months. And the reason being is it all depends, your eardrum being round like this, it would depend on where they put the tube. Because your eardrum grows, and it starts growing from the center out. So depending on where they put the tube, if they put the tube near the end, it would outgrow itself and just kind of pop out of your ear sooner than if they put the tube on more in the center. They also have tubes now that open and close with the need.
How do the tubes come out?
They come out just on their own. That's why many times you have to go back to the ear, nose, and throat physician also to see if the tubes have come out or not. Because if the tube is in your eardrum, you want to make sure you stay away from all kind of water, showers, swimming. Because if not, then the water would get into your ear, it would go through your ear canal where your wax is, and it go right into the tube and go into that area that you talked about before, which is where the fluid develops. So you want to make sure that you go back to the doctor after you have the tubes put in to make sure that the tubes are not still in the eardrum, or you could be causing yourself even more problems than when you started with. These are great questions. How did you come up with these? You did a great deal of research already. Congratulations.
Do the holes where the tubes are placed close up?
Yes, it heals up all by itself. Can you get a hole in your eardrum that doesn't heal up on itself, that maybe wasn't even caused by a tube putting in? Yes, sometimes you can get them so big where somebody needs to go in there and put like a patch on it. It really isn't all that uncommon for that to happen. How does that happen? Let me give you one idea of how that can happen. If somebody was to slap me on the side of the head, the pressure from the air going into the ear could be significant enough, forceful enough, that would actually what they call rupture or tear the eardrum. Now that that you'd probably need to go into the hospital and get it surgically repaired.
Um, what type of antibiotics can help ear infection?
Right now, they give an awful lot of myosin drugs and penicillin type of drugs. They're starting to, right now, hesitate in giving antibiotics as frequently as they did before. The reason being is if you get an antibiotic frequently enough, you actually can become immune to the benefits that you're supposed to get from that. So many pediatricians and ear, nose, and throat physicians or whatever won't recommend antibiotics until they're sure that you have an infection. Can you have fluid in the ear and not an infection? Yes. Don't need antibiotics. Can you have a little bit of fluid in your ear and highly infectious where it's painful? Yes. That's when they would give the antibiotics.
Can antibiotics also cause hearing loss?
Yes, certain types of antibiotics can. The myosin drugs, given over a longer period of time, and a long time ago they used to give quinine and things like that. The reason they would give that is they would use those strong drugs if your body was fighting infections that were so severe it was the difference between life and death. So if it's the difference between life and death in a drug that can cause hearing loss, needless to say, you'll go with the drug to make sure you save the person's life and see what effect that the myosin or the antibiotic drug had. Nowadays, frequently, if you're on any type of drug like that, they call it an ototoxic drug, which means oto meaning the ear. You're monitored by an audiologist to see if it's affecting your hearing, and if it is, then it's adjusted medication. Amount or type is adjusted.
When a person's ear hurts and itches, could they have swimmer's ear?
Well, yes, and actually, swimmer's ear can be prevented, if I can use that, by putting drops in your ear that you can buy over the counter and talk to the pharmacist. And that generally occurs for people who swim a lot. Okay. Also, people who swim a lot have chlorine, let's say, from swimming, and their ear canal, which is made of skin, just like skin on your body, can dry up. And if it dries up, it flakes. I mean, you don't see it, you don't feel it, until it comes to the point where it prevents sound from getting through it. And then it sounds like you got a hearing loss, and you do, but it has to be it's due to the flakes that are mounting up in your ear canal that's preventing sound to get through to your eardrum.
If a child has allergies, will they be more likely to get ear infections?
Yes, and the reason being, as I mentioned before, you have this tube in the back of your throat, this side, and the middle ear on this side. So if they have sinus, colds, that's coming down the throat, the back with your nose up here coming down, and a little inhalation. Who doesn't do that every day? You know, I mean, it's breathing. They can put it right into the ear that could cause an infection. So yeah, children that have allergies, especially if it's some of the children have it because they've got it from their parents, their grandparents. It's genetic type of thing. So many times hearing losses like that run into families because grandpa had it and now dad has it or whatever, and it just goes to son and daughter after that.
How often should a child see a doctor if they have frequent ear infections?
Actually, as often as need be, and let me see if I can clarify that point. If you notice that one or both of your ears are plugged up, get it checked out. Even having a hearing loss in one ear and not in the other ear can affect one's educational progress, which means school progress. The reason being is that if it fluctuates, it comes to the point where one day you're hearing well, and that makes a big difference on how well you pick up the teacher. Okay, so if you notice a problem, especially at your age, you're an adult enough to be able to tell mom and dad, I'm having some problems. What does one do with a child that's a lot younger than you? Sometimes when they have a hearing problem like that, they don't come when they're called the first time. or they sit close to the TV. Or their speech and language starts to get worse because they can't hear themselves when they make a sound incorrectly. If you make a sound incorrectly, say, oh, and you change it. If you had a hearing loss, certain hearing losses, you wouldn't hear the difference between what's correct and what's incorrect, and therefore you wouldn't correct yourself.
If fluid drains from a child's ear, should you call the doctor right away?
If you see drainage from the ear, yes, because that's not normal by any means. I would think that perhaps even prior to drainage coming out of the ear, the child is going to be experiencing some pain. Because what probably happens is fluid is developing behind the eardrum, and it gets to a certain level where the eardrum can't hold it in anymore, and it ruptures the ear or breaks the eardrum. There would be a lot of pressure in the ear already prior to seeing any drainage coming out. I think it would be the exception to see drainage coming out and not having symptoms of a hearing loss prior to that.
Is there anything else you would like to talk to my class about?
Yes. In your health and I think it would be health class, you learn no smoking, no drinking, no drugs. They used to call it stranger danger. I don't know if they call it. Okay. I'd like to have your class be aware that children your age and a little bit older are even getting hearing losses sooner than their parents and their grandparents. And one of the reasons is that they're exposed to a lot of louder sounds than their parents were or their grandparents were at your age. With the iPhones, should you not put them in? Fantastic. But when they're so loud that I can tell what music you're listening to, even when they're not in my ear, that's too loud. And if you're in an environment, a place where you have to talk any louder than we're talking right now, this is a conversational level loudness, intensity. If you get to the point where you're in an environment where things are real loud, where you have to talk this loud to make sure you're heard, odds are it's a noisy environment where it could be causing a hearing loss in the long run. They should teach your class and the whole school, and it only takes like 5-10 minutes, 3 things. If you're in an environment that's extremely loud, you should have 3 options. 1, leave. Okay? If you can't leave for whatever reason, wear some type of hearing protectors. Do adults wear hearing protectors? Let me tell you this. All of the military bands and all of the college bands, marching bands and performance bands, all wear hearing protectors during practice. Why? Because they have shown that constant exposure to loud sounds, be it music or whatever, can cause a hearing loss in the long run. Studies have shown that teachers who teach music in high school and grammar school get hearing losses sooner than other teachers because they're exposed to this loud noise all the time. So if you're exposed to loud noise, get out of it, wear hearing protectors, or if you can, lower the volume. Because if it's something like a TV, lower the volume of the TV. If it's like a stereo, lower the volume of the stereo. And if you're listening to music, just lower the volume. And what you can do is parents now can buy units that their children can listen to, where they can put a governor on it, which means they could limit how loud it gets. And so that's what you need to do, because right now children your age and a little bit older are getting hearing losses sooner than their adults. That's what I'd like to say.
Thank you very much for talking to my class and letting me interview you today.
You're more than welcome.